My name is Yolanda Jennings. I'm a member of Salt and Light Church in Southwest. I live in West. I've lived in North Philly for many years, and I work in Center City. So I see this city from every angle. And from every angle, the message is the same. Philadelphia is becoming a city where the people who work here and serve here cannot afford to live with stability.
Tell it.
I work full-time in social services, serving Philadelphia residents facing housing instability, substance abuse, mental health diagnosis, and safety concerns. While I am navigating the same affordability crisis, I help others through. I rent a room in a shared house because that's what I can afford. The average room in Philly is now $800 to $1,000, while the average one-bedroom apartment is over $1,700 a month, with thousands of dollars required up front, 3 times that to even move in. That's not a barrier, it's a wall. Working people, including those with college degrees, are juggling 2 and 3 jobs just to stay alive. While the city's unpaid, a single adult needs to make about $75,000 a year to live comfortably. Yet many of us earn too much to qualify for help and nowhere near enough to afford market rate rent. One emergency can push someone to the edge of homelessness. I acknowledge the steps the city has taken, including the home initiative and reforms to application fees and security deposits. Those changes matter, but they do not solve the core problem.
Amen. Tell it.
Rent is still too high. Wages do not match the cost of living. And new housing is being built in neighborhoods where long-time residents cannot afford what's being built. The birth tax structure and the removal of the 100,000 exemption have increased the burden on small businesses and community organizations, while developers continue to benefit from long-term tax evadance. Many of those developers don't live here, they don't raise families here, and aren't part of the communities absorbing the impact. So the ask is clear. We need rent stabilization tied to local wages. We need accountability when developers receive public tax breaks. Public money must mean public benefit. We need housing policies based on real Philadelphia incomes, not developer profits fueled by New York salaries.
Come on now.
People who work here, serve here, and truly love this city cannot afford to live here. Thank you.
Good afternoon, everyone, and thank you so much. My name is Amy Isabel, and I'm a member of First Unitarian Church. I'm a resident of Center City. I moved to Philadelphia in 2022 to be closer to my sister and her family after many years of frequent moves for work. In my professional life, I'm a nurse practitioner working as a primary care provider in an addiction medicine. I work primarily with patients who are experiencing homelessness or housing instability. In my job, I hear stories about the pain of housing costs and the difficulties of the shelter system daily. This also directly affects how I do my job. How can I treat diabetes if someone living outside can't store their insulin in the fridge? How can I manage asthma if someone has to decide between paying their rent or buying their inhaler? How can I help my patient to keep their job if their psychiatric medications are only dispensed at certain hours by shelter staff? The upsetting truth is is that the life expectancy of someone experiencing homelessness in this country is just 48 years old. Most of my patients and many people in Philadelphia are one accident, illness, or injury away from eviction. One of my patients, whom I will call Mary, delivered packages for CPS for 20 years until she tripped and fell down the front steps of her house and broke her ankle, lost her job, leading to an eviction when she couldn't pay her rising rent. This started a downward cycle since she lost her insurance, which she got through her job, and couldn't get the cast removed, causing a terrible skin infection, which she couldn't properly treat at the shelter. Mary felt lost, and honestly, I felt lost too as her healthcare provider. This is the moral injury of my profession. How can I provide the standard of care that my patients deserve if there are such insurmountable barriers to this care? I have lived in the same apartment since I moved to Philadelphia, as close to my family and within walking distance to my job, my church, as I don't have a car. This is my community. I feel lucky to have the connections that I was wishing for when I moved to this city. I've been so warmly welcomed by you all. However, the reality of my job, like so many others, is student debt. I'm in almost $160,000 of student debt. I work full-time in a well-compensated job, but the truth is I will likely be priced out of my apartment next year as the rent increases and my student loan payment plans change. The thought of needing to uproot my life and move once again is frankly exhausting. When the power organizers asked me to speak today, I feel like I didn't have a story. The stories of my patients show the day-to-day extreme effects of poverty, racism, and the housing crisis on health and life expectancy. I carry their stories with me, and I honor them as my neighbors. But that's just it. I want to stay neighbors. I may need to leave my neighborhood too. It pains me that I may have to leave the community that I've worked so hard to join and contribute to meaningfully. This issue touches each of us in the city in some way, regardless of our background. The most vulnerable will feel it first and have felt it first, but the tide will carry us all along soon. The health of our neighbors and our communities should not be subject to the whims of rising rents, increasing housing costs, and limited social safety nets. Thank you very much.